Healthcare facility security presents unique challenges, particularly in a setting like the University of Utah Hospital, which operates within or adjacent to a vibrant campus environment. Joining me today to discuss maintaining safety in this complex healthcare ecosystem, we welcome Dustin Banks, Associate Executive Director of Facilities Management at the University of Utah Health, and Glenn Smith, Director of Health Security at the University of Utah. Gentlemen, thanks for spending some time with us today.
Thanks for having us.
I want to start here today. We talk about these security challenges that come with having a hospital next to a university. Just give us an idea of what makes that more complex then. Is it just because you've got a bunch of students and traffic that's in one area? What makes it more of a challenge having a facility, a hospital facility that's adjacent to a campus?
Well, I think that there's multiple challenges that are at hand. I think the first thing is that you're mixing an educational setting with 45,000 students with 26,000 staff members and now thousands and thousands of patients that come through that at the time that they're coming in have great need, some of the worst part of their time of whatever they're dealing with and sick and afraid. That comes with behavioral challenges as well. And so when we're trying to create different, unique environments, how do you keep everybody feeling safe when there's so many different complex items happening?
Yeah. Is that the complexity of it, Glenn? What do you think?
Yeah, and I also think that we have, a large student population in the medical field. So there's a lot of crossover between campus and the hospital when it comes to the students. So we're trying to meet the needs of our staff, obviously the patients first. That's our goal up there, is to provide excellent medical care. But then we also have patients and visitors and just day-to-day deliveries and everything that makes that hospital function.
I think most of us think of a hospital like it's a place you go to get better or to get treatment. I wonder if you could give us an idea of like what kind of security challenges are presented at a hospital. We think of it, everyone goes to the hospital for limited amounts of time, usually, hopefully. So you don't maybe see what kind of security incidents you maybe have to deal with. Can you give me an idea of what you deal with up there?
Sure. Yeah. So we consider ourselves healthcare security professionals, not necessarily a security guard. No disrespect to security guards. We need people out there watching property construction sites, making sure property isn't bathed. But our team is connected with the medical staff, and I think that's what's unique about our team. We consider any kind of a patient or visitor disruption. The staff needs support to be able to have their job go kind of seamlessly throughout the day. But when they have to deal with somebody in crisis or somebody that's being aggressive or acting out due to numerous types of stresses, whether it's mental illness or whatever, our team kind of goes in and helps mitigate some potential problems.
Yeah. Marty, I'd also take it in a different direction. As people go to the hospital, not because they want to. I don't go to the hospital because, it's because I feel sick.
Yeah.
There's something wrong. And when you're at the worst part of your moment, you may not be acting or thinking as clearly as we are today sitting here. And what I mean by that is there are times that you're going to go to the hospital, and because you're not thinking as soundly or as clearly as you would normally, your behaviors might often become much more disruptive than they would in a normal environment. And so considering that, how do we help communicate to try to mitigate some of these things from happening? When people are faced with fear and trauma, we react, we don't respond. And generally when we react, we fuel the fire, whereas if we had a chance to sit down like we are today, we're going to most often respond to one another, which is a cordial conversation. When you are faced with the worst things in your world at that moment, reacting in a disruptive way is their normal at that time because their fear is real. However, their fear being real, for us, we have to then match that type of emotion to control the environment. That is very hard because then we're putting our security team in environments where also it's complex and sometimes unsafe for them, but they're doing it to make sure that they're trying to keep everybody in the environment safe, including that person that's being disruptive.
So how do you tailor your security measures knowing that that's the kind of environment that you can be in? You mentioned sort of matching that emotional level at times, or maybe that starts with coming in and being more understanding of the situation people are starting in. What other elements go into like tailoring the way you treat security in a healthcare environment?
Yeah, I think, again, part of our setup is pretty unique where our security officers get 7 weeks of training, and that's pretty astounding compared to a lot of other organizations. And a lot of that is based on customer service,
and de-escalation skills. So again, our team is part of a crisis prevention intervention and all sorts of other non-physical de-escalation tactics. So again, I think having our team that are experts in being able to go and de-escalate these situations is key. Then we also partner with customer service to look at other options when it comes to maybe moving patients or setting expectations with a patient or a visitor to let them know, hey, staff's here to help you get better. So let's try our best to work as a team to have that accomplished.
How do you bridge that where you've got a healthcare environment where people are coming in stressful situations? They're there to be treated, to be healed, but you've got to maintain security. How have you collaborated to improve healthcare worker safety while you're sort of maintaining both ends of that spectrum in balance?
This is dating back many years. And so when I first started getting involved with our security and safety forces many years ago, 10 or 15 years ago, we did not do a very good job. It was really more of the reaction. We were reacting to what it was in front of us. And now what we're trying to do is to understand what that person is going through, but also that we are a critical component of the clinical care team. And being able to have the relationship that we have now, from security to our nursing staff and our physician group, we are all coordinated in one unified effort of response. First off, we try to make sure that we are entering or engaging into a situation as a non-emotional part of the conversation, but then also allowing ourselves to hear what it is that person is going through. So that way we can have a non-violent response for anything that we're faced with. And hopefully going into something as a de-escalation tactic, understanding what that person's going through, and then our security team mixed with clinical components have a conversation about options. It's not stop this and we walk away. We understand you're going through something that's very traumatic. Here's what we understand. Here's what we can do to help. And trying to get an individual to de-escalate where their emotional state is has been very effective. But it doesn't happen if we don't have the relationships across the board and feeling like we are one team.
I would just add that when I started 7 years ago, trust between the hospital staff and security, law enforcement was not great. There were some situations that demanded some changes, and that's where my position was created. And so, again, just like Dustin mentioned, the relationships are huge, and getting involved with nursing leaders and physicians so they can understand what security can provide for their teams so that they can do their jobs safely. And so I think that's probably been the biggest shift in the last 7 years, just hiring the right people on our team, giving them the right training, and setting the expectations as to, hey, you go out and build these relationships with these folks because they're our customers.
And realistically, I think where we began was a real state of saying, how do we provide an exceptional service even in times that are hard? And our security and safety teams are truly designed around that 99% of the time. They're going to be a customer service agent. They're going to be able to address any situation with calm, collect, thoughtful conversation. And then that 1% of the time, their training is going to be able to take over still in a nonviolent response to control or mitigate an issue from happening. But again, truly coming at it from a place of sound communication and effective communication has been very effective.
You've had a nice approach to it and seem to have resolved a lot of the issues you mentioned over the last 7 years, building those relationships. I'm wondering, what emerging healthcare security challenges do you foresee? What's the next big problem or big challenge that you've got to go address?
I think that there's many. Unfortunately, I think that we are seeing a drastic shift in drug and alcohol misuse in our environment, not just here locally, but nationally. It's becoming much more of a challenge and a problem. We are seeing that happen in Salt Lake City, in our little town. The other side is that there is an increase of mental health component that is going rather undiagnosed and untreated, which then makes our challenges even more great. We once were a very small town, and I think that was fun for a while, but we have, as a state, decided that we're going to grow. And growing into an urban environment has its own challenges, and we are starting to see that.
Yeah, and something about our hospital that's unique. I mean, we don't just service the Salt Lake Valley, or I can't remember all the areas, but we from Idaho parts of Nevada, Wyoming. We get patients flown in or transferred. We also have a contract with the Department of Corrections, so we have plenty of patients from Department of Corrections and the local jails. So again, there's a lot of challenges and unique little situations that our teams get involved with and help support to make sure everyone's staying safe.
And I think that's a great point, Glenn, because when you look at the amount of people that we do serve, it actually tallies about 10% of the total population of the United States. A lot of people would never have thought that Salt Lake City, Utah would see that many people, and we do. When you look at being a level 1 trauma center as well as the only burn center in the Intermountain West, we are going to see some of the more complex and difficult cases clinically than most other hospitals in our region. With that brings, again, people at some of their most challenging states. They're afraid, their families are afraid, and sometimes their behaviors represent that as well.
Well, as a father who's had a child at Primary Children's and up on that area of campus, I appreciate that when I was there, I didn't have to worry about security. So, Glenn, Dustin, thanks for your work on this and for keeping that part of campus safe.
Thank you for having us.